Every year, hundreds of thousands of men and women choose blepharoplasty, I'm probably saying this wrong, to improve the way that they look. That's the surgery for droopy eyelids. It makes you look older. Those droopy eyelids can impair your vision. Dr. Michael Kim is here this morning to tell us more about some of the options to consider when you're dealing with this issue. And so many of us have those bags under our eyes or the droopy eyelids, and it can really affect your vision.
Yeah, the lower eyelid surgery is pretty common. Usually people complain of being tired, you know, and I think I have some pictures that fat protrudes. And basically what it is, people don't realize it's not just the fatigue and swelling, but our fat protrudes on our lower eyelids. So normally we have what we call a retinaculum, orbital septum, that holds our fat in. And genetically, even patients in their 20s, the fat protrudes and gives us that puffy, you can see on the upper left picture of that puffy lower eyelid surgery. And I've done surgeries on patients in their 20s. And so the definitive procedure is actually to remove that fat. You can see on the bottom right an external incision to actually remove the 3 pockets of fat in the lower eyelid. And that gives a much rejuvenated procedure. Now, there are 2 ways to remove the fat. One is externally from an incision under the eyelid on the skin. And the second on the right side, it's hard to see, is actually an incision inside or internal transconjunctival to take the fat out from the inside of the eyelid. And the trend seems to be from the recent meetings is that most surgeons now are electing trying to get the fat from the inside because there's less scar tissue produced on the lower eyelid from the outside.
And once that is removed, that's a lasting procedure, correct? I mean, you're done with that then.
Yes, once you remove the fat, most of the time the fat stays. You can see the results here, the before and afters. And on the lower, it's probably easy to see the fat pockets are removed from the inside. You can really see the dramatic improvement in how the appearance of the patients. Now, on the next slide, some patients are candidates for non-surgical rejuvenation, which means putting filler. But be very careful. Some places, I saw recently an article about some guy in California putting permanent silicone in the lower eyelids to try to fill in that tear trough. See the bottom left, a little groove that makes you look tired. And if the quality of the skin is good and the fat pocket's not too big, you can actually camouflage that by putting some filler there. But it's fraught with it's very difficult to get a perfect result. And if you put something permanent there, you have a permanent lump of something that you can't remove. So I would warn patients that if you're going to get something done like fill-in or lower eyelid, try to steer away from permanent fillers. You can see on the bottom right that there was overdone on that bottom middle picture, and then we were able to reverse it with some enzymes so that you can take the filler out if you don't like it.
Now, who would you recommend does something like this? I know a lot of different types of doctors do eyelid surgery, but you've got to be careful, I would think.
Yeah, it's most important to have someone experienced, either a board-certified plastic surgeon, oculoplastic surgeon, someone who does a fair number of these, knows the anatomy, and even with the fillers. You don't want to go to someone who doesn't really know the anatomy because there's potentially a lot of structures you can injure. There are cases, reports of blindness. So you want to go to someone who not only can do the filler but the surgery and give you options because you may be not a candidate for the fillers and you really need the surgery, et cetera. So you want to go to a person that's honest, have a good reputation, get some patients that have done, and go from there.
All right, good advice. Thank you so much, Dr. Kim. As always, we appreciate it. We're going to put this information for you on our website, linknews.com. It's 8:24. We're going to be right back with your weather and traffic.